we're going to go ahead and get started. Thanks everybody for joining us on this cold Friday afternoon before the holiday. Thanks for taking some time to join us. Just a couple quick notes about the session today. We're recording it. So after the session, we'll provide a link to the recording, as we typically do with our meetings, and follow up with any additional materials after the session. We are using the chat and the Q&A today, so if you have a question or you have a comment for Allison throughout the session, feel free to use those tools. We have a pretty small group, so we can also, if you want to raise your hand, we can unmute your mic and you can ask those questions directly. So with that, I'm super excited to introduce Allison McKee. She comes to us from Pennie. I understand she's in the Philadelphia area today. So Allison, I'll turn it over to you to get us started.
Wonderful. Thank you so much. It's wonderful to be here with everyone today. Like Craig said, I am just outside of Philadelphia. That's where I'm coming to you from today. And I appreciate you joining me on a Friday afternoon. I hope you are safe and warm inside your office, your home, wherever you may be today. But as Craig said, I am the outreach manager at Pennie, and I am really delighted to be here today. It's actually the Friday before one of our big open enrollment deadlines. We'll give you lots more information about that throughout the presentation. But it's been a busy time at Pennie, but an exciting time. So I'm happy to be here today to talk to you a little bit about Pennie and what it is that we do. A little bit about me. I am actually newer to Pennie, so I started with the organization last spring. But I know I was talking with Patrick yesterday to get prepared for the session and sharing a little bit about what I've done in the past. I've lived in Pennsylvania my entire life, and most of my career I did community-based work in the nonprofit space. And then before I came to Pennie, I was at Temple University, focused mostly on student well-being and talking to students about dating and domestic violence prevention, mental well-being, all things kind of keeping students healthy and safe while they were at the university. And then I transitioned to do this work. And what I've really loved about doing this work is it's kind of taken me back into the community space where I get to work with folks doing all kinds of different things across the state and the Commonwealth to help people in different, spaces. But to me, it's all about helping Pennsylvanians be as well as they can be. So I really love this work. It lets me do the outreach and education piece that I love, but again, connecting it all back to what I think people all deserve access to, which is the ability to get quality care when they need it and the ability to stay well and to stay healthy and live the best lives that they can live. So happy to be here with y'all today. As Craig said, happy to take questions either throughout the presentation or at the end. I'll make sure I leave plenty of time for that. If you have a question right now, I'm not really seeing the chat with the way I have the presentation set up. So if somebody can flag a chat for me, that would be great, or just come off mute. That would be great too. But I'm happy to take those. Oh, yep, there we go. I can see a chat right now. So maybe I can, yep, perfect. But happy to keep this informal. The way that I kind of framed the session today, I thought it might be helpful to start with that. We realized that folks could be joining us for a wide variety of reasons. You may be thinking about the folks that you serve. You might be thinking about their families and getting coverage for them. You might be thinking about the employees and the folks that you work with. You might even just be thinking about the broader community and how you might be able to connect folks that live and are in the communities that you are. Because of all of those reasons, I've kind of structured this presentation to be a pretty broad overview of what Pennie is and what it is that we do, a little bit about open enrollment, and then all the opportunities throughout the year for people to get connected to coverage. I want to definitely talk about the types of support that we offer to help people get connected to coverage because, being newer to Pennie myself and not really, having to get caught up on this world, it can be really confusing when people are trying to choose health insurance and trying to understand all the parts of what health insurance coverage looks like and making sure they're getting what's best for them. We do have a lot of supports in place to help people do that, walk them through the process, and then kind of ending with all the ways that if you're serving people in any of those capacities, that you can help refer them and get them connected to somebody who can help them. So you don't have to be an expert in any of this. You just have to kind of know what Pennie is and all the ways you can get them over to us if they do need help. Just a little bit about what I have planned for today, and I'll go ahead and get us started. So let's go ahead. So a bit about who we are, because sometimes people surprisingly don't know. This very early this morning, I was in for a healthcare appointment, and I was talking to a provider, and people just make small talk. Just like, what are you doing later today? I'll go into work. Where do you work? And I started talking about Penny, and she's like, "What is that?" And I was so surprised that, even as a healthcare provider, she wasn't really aware of what Penny was or what we do. And as I was talking about it, she was like, "Oh, I'm approaching retirement age, but I think I'm going to retire before I hit the age that I would qualify to get onto Medicare. Is that something that I could go to Penny for?" And we had this great conversation about that. So I always like to make sure people understand what it is that Penny actually is. So we are what's called Pennsylvania's state marketplace. Lots of states now have these, and more add them every year. Georgia is actually the most recent state to come onto the marketplace. But we were created by a bipartisan and unanimous law in Pennsylvania that created this marketplace. It essentially allowed Pennsylvania to move from healthcare.gov. So before this, that's where Pennsylvanians would have purchased insurance if they were looking for individual coverage or family coverage, right? Through the healthcare.gov marketplace, or what we call the FFM. And in 2021, that was the first year that they could come to Penny. The great thing about states having their own marketplace, and the great thing about us being Penny, is it does help control costs for coverage. It helps with the plan options that are available and consumer choice. It helps individual states coordinate with other organizations across the state, because instead of folks going to there's great things about healthcare.gov, but it's folks going into a pool for much larger pool. When it's at the state level, we can really coordinate with other state partners. And I'll talk more about that as we go through the slides and kind of get in more depth of that. And the other thing that I really love is, like, we talk about this all the time. It's like a group of Pennsylvanians serving other Pennsylvanians. And I think there's something really great about that. I know for the folks that work at Penny, that's a part of why we want to do the work that we do, is like, we're committed to helping other people who live and work and play in our community. And there's something really great about that. When someone calls in and they need help, or someone's looking for support, someone wants an outreach program, you're talking to other people who live in your community and are here to help you, which is really great. So a little bit about our mission. It's really to maximize the number of Pennsylvanians with affordable quality coverage. You'll notice that it doesn't say to maximize the number of Pennsylvanians with coverage through Penny. We really are about making sure people get the coverage that's best through them, for them. And sometimes that's not Penny, right? And that's one of the things I also love about the work that we do on the outreach team. If somebody's best option is medical assistance, that's what we want them to get connected with. So we have a lot of ways that we help facilitate that. And again, I'll go into more detail on that. But it's making sure that people get covered in the way that's best for them and gets them the most affordable, best quality coverage. And then that part about facilitating informed decision making. We want to make sure we get as much information out there to folks and as much support to help get people through a process that we know is really confusing and difficult at times. So again, this just kind of goes over that high quality, affordable plans that we offer, and being the source for financial savings, which again, I'll break down kind of what that looks like for folks. I think sometimes when we say that, people are like, what does that mean? I will actually explain what that means. And we can help pretty much anybody that doesn't get coverage through other places. And I will talk more about this relationship with medical assistance and CHIP, and this no wrong door policy as we go throughout the slide deck in more detail. This is a little bit about how many Pennsylvanians get coverage through Penny. And I will say this 436,000 was at the end of last open enrollment. We're in open enrollment right now, and like daily looking at that number, it's larger now, which is great. It means more people are accessing coverage, which is what we want. And at the end of open enrollment, we always kind of publish what that number is. So more to come on that as that continues to grow. We also always like to talk about this great number of 90% of customers receiving financial assistance. I think that's really important too, because I know when we're out in the community on the outreach side, so often people are saying, I don't have healthcare coverage, but honestly, it's just not something I can afford. And I get it. Healthcare coverage is expensive. We're often saying to folks, like, please consider checking it out or exploring the option, because a lot of people are qualifying for assistance in one way or another. And that's a great question. Open enrollment has kind of two end dates, and I'm going to talk about that. The first deadline is December 15th, but that's just for your coverage to start January 1st. The second deadline is January 15th, and that's for your coverage to start February 1st. But you're going to see as I go through this, there's a lot of things that qualify folks to get to be eligible for coverage kind of throughout the year. So I'll go over that in more detail too. But that's a great question. This is kind of who can use Pennie, and when you look at this, it's a lot of people. It's really anyone who doesn't get coverage through other places. But some things that I like to point out to folks on here are folks who might be considering COBRA. I often talk to people about this. I know I've experienced times in my life where you change jobs or you're out of work for a little bit, and COBRA can be very expensive. People can come onto Pennie for a month, 2 months, 3 months, whatever it might be, while they're waiting for coverage to kick in a new job. Pennie can often be more affordable for folks in that case. Part-time employees who don't receive coverage through work are eligible to explore options through Pennie. Gig workers, folks who just like would not receive coverage through work, are often getting coverage through Pennie. Small business owners. Again, the person I was talking to this morning at my appointment who was like, hey, I'm 62, thinking about retiring around 63. Could I explore Pennie? All of these are different reasons that people might consider Pennie. So this way that we can kind of provide cost savings, it looks like these two primary buckets for people. And we just, the other day at work, we're having kind of this very detailed training about like how these are calculated. But the easiest way to explain it, and the way we often talk about it externally, is just these two buckets of what we call advanced premium tax credits and cost sharing reductions. So the way to really think about it is the advanced premium tax credits are, people are eligible for tax credits in advance based on their income and household size that would reduce the cost of their premium. You'll sometimes hear us say like the monthly cost of health insurance, because what we found from being out in the community is that like even the word health insurance premium is sometimes like it's better to just talk to folks about like the costs that they pay per month. So it's that whatever you would pay per month, this tax credit can help reduce it in advance. And that can really help out household budgets for folks. I mean, we have folks who would be paying $700, $800, $900 a month, that advanced premium tax credit can take them down dramatically to what's coming out of their pocket every month. And think about the impact on the rest of their household budget that can make, right, in terms of groceries, electricity, clothing, other things that they need to pay for in their house, in their household, to keep the household going. So that's one way that people can access savings. And I'll also talk about how that's calculated and how people find out what they might qualify for there. But generally, the way that is calculated is based on, again, income and household size. And then the other level is called this cost sharing reduction. That works out in terms of savings for copays, deductibles, and other costs when you actually go to the doctor and access care. And that's specific to like one level of plan that we offer, which is called a silver level plan. Again, I don't want to get too far in the weeds on it, but these are kind of the two ways that people save. Always like to put this out just because we don't want to say to people, you know, we offer this savings and then people go, what does that mean? You know, is this real? It is real. And these are the two ways that we're able to do it. So this is just a little snapshot, and this is data from the current year in terms of what do people pay based, you know, a little snapshot percentages of what people pay. Again, it's based on income. If someone has less income, they're likely to pay less. So these are per month rates. So it's 17% of people are paying less than $1 per month, 46% of people paying less than $80 per month, and 32% of people paying less than $30 per month. And then there's the statistic below about these same plans without financial help could be $400 to $500 a month. So we're talking about like pretty significant financial savings for a lot of households. Again, it's why I really encourage people who, like, I understand why people believe that health insurance feels unaffordable, but it's definitely worth at least exploring it and checking it out to see what they might qualify for. This is really great information that I always like to share with folks. The plans that are offered through Pennie have to cover these 10 essential health benefits. And these are actually mandated to be covered through the Affordable Care Act. So these aren't our specific regulations, but any plans that are offered through either healthcare.gov or through the state-based marketplaces have to cover these benefits. But I always like to let folks know that like these are things that if they're coming to Pennie and looking for plans, they can be certain these things will be covered. So it's things like emergency services, maternity and newborn care, mental health and substance use disorder, including behavioral health treatment, prescription drugs. And then something that I know I've been talking to folks a lot about is preventative and wellness services. Um, things that you would go for on an annual basis, like a wellness visit, vaccines. Um, when you reach a certain age and there are certain things that you need to do every year to protect your well-being, whether it's things like mammograms, colonoscopies, whatever it might be, if they're preventative, they need to be covered under these plans. And then the other wonderful thing is that you cannot be denied coverage due to pre-existing conditions. I am of the age when that I remember a time when health insurance could deny you because of pre-existing conditions. I think that sometimes people are either young enough or just like memory is short and people don't remember that that was a thing. Um, but these plans can't deny people because of that. So that's something to also give people peace of mind that they will not be denied coverage because of that, and that health plans cannot limit what they spend on their care in a year over a lifetime. So the plans have a measure of quality because of these things that have to be a part of them that I think is important for people to know. And then in terms of just options, they follow these what we call metal, like gold, silver, bronze. And there are some platinum plans. Pennie doesn't offer very many of them, but some exchanges do. And these are based off of the way plans work on healthcare.gov. So, a gold plan tending to be you pay the most for a premium, but then the most level of services are covered, silver kind of being more moderate, and then bronze being the lower end where you're going to pay the least, but also the least amount is going to be covered, right? So people can kind of choose based on how often they think they're going to need prescriptions, different types of medical care, how healthy they are, how young they are, what their household needs are, and what fits their budget. And the marketplace has different insurers to choose from. So this is also really important. I think sometimes people think they're buying insurance from Pennie. We're not an insurance company. We are the marketplace that the insurers put their plans in for people to choose from. So the insurers that people are purchasing these plans from are, places like Independence Blue Cross, Jefferson, Highmark, UPMC, and they kind of, the plans depend on where people live, right? So insurers put forward different plans for different parts of Pennsylvania, depending on where they tend to serve and where they have coverage. But they're not buying them directly from Pennie. We're kind of the place that gathers them and the insurers offer their plans through. And then we're the mechanism through which people can access the tax credits and the cost sharing reductions. Also good to know that we have dental coverage. I've been telling a lot of people about this because you can purchase it with health coverage or you can buy dental coverage just independently. I know I talk to a lot of folks out in the community who may have medical coverage through work, but have no dental coverage and are very excited to know that they can come to Pennie and check out options just for dental coverage. So that's something that I always like to include in case anybody is having trouble accessing dental coverage. I know that can be something that employers don't always have the ability to offer, or that people may be doing without, just because it can be a challenge to get access to. So people can come and browse for that too. This is just a little bit about like what it means and why it's important, and we talk to people about that peace of mind and financial security if something unexpected happens, if there's an injury that no one plans for an injury or for an unexpected illness, but knowing that you're covered on hospitalization and some of those things is important. The financial savings through the tax credits. Unfortunately, there are plans out there that are low quality or, even kind of veer into that territory of being a little bit of a scam. And we do sometimes hear from folks who will call in to our contact center and say, hey, I purchased this plan and then I went to the doctor, I went to access it, and they said nothing is covered. Um, and we always try to get them to the right place so that can be reported if it is a true scam, or we can try to help them figure out what it is that they've purchased and kind of get them resources. But sometimes people are buying things that are they think it's a health insurance plan, but it's like a discount card. And unfortunately, that's, people are not always transparent when they're selling that to someone. So if people are purchasing through Pennie, one good thing is they can be sure that the things that I mentioned are covered. It's actual health insurance. It's going to cover the things that it says that it will. Related to that, if you ever have somebody that's searching for Pennie, one thing that we ask people to be very careful about is like to make sure that they are going to pennie.com. That is our website, and I'll talk about it later. And not just Googling Pennie. Unfortunately, one thing that has sometimes happened in a lot of the states that have these state-based marketplaces is other companies have taken the names of the state-based marketplaces and gotten websites that are close, so that when you search terms, their stuff comes up first. So we always ask people to be really careful and just make sure that you're on actual pennie.com when you're searching or browsing. And then, of course, I talked about plans that cover a full range of medical care, coverage for pre-existing conditions, and all those really important preventative care services. So open enrollment, it's now. It starts every year, November 1st. So it's really important to know. And like I said, that first deadline is December 15th. So it's Sunday. But that's just to be covered by January 1st. So people still have a few days if they want to be covered by January 1st, but they have until January 15th to have coverage that starts February 1st. So there's still time for people to get covered. And the phrasing of this, I know it says it's the only time Pennsylvanians can be covered. As I go through this presentation, you'll see there's actually a lot of opportunities that open these things called special enrollment periods that create really a lot of other opportunities for people to be covered. So this is kind of the only time of year that like you don't have to have any qualifying life events to shop and to be covered. The rest of the year, it's true that you would have to have one of the qualifying life events. But so if you think you're not going to have a qualifying life event as I go through and describe them, now would be the time to check it out. But there are a lot of opportunities that we try to create throughout the year for people to get covered and to check things out. We always like to tell folks too that if people are already enrolled, it's also a good time of year to update their information and to just check out what plans are out there, because every year the plans do change and the prices change. So if people shop every year, they can often save money or sometimes even get better coverage just by kind of shopping around on the platform and looking at what's new in their area, because the insurers change their plans every year a little bit. So this is a little bit of like a timeline of open enrollment. You can see the November 1st through January 15 and the deadlines, but you can also see the special enrollment period down at the bottom that kind of says all year. So the special enrollment period, January 1st through December 31st, is for anyone who experiences a qualifying life event. So on the next slide, I'm going to talk about what those qualifying life events look like. And there's a lot of them. So basically, if you have any of these things that are considered a qualifying life event, they open what's called a special enrollment period, which gives you 60 days from the date of that qualifying life event to enroll in Pennie. So they can be you lost healthcare coverage for a wide variety of reasons, right? You might have left a job, lost a job, any of those things. You could have changed residence. So you could move into Pennsylvania from somewhere else. You could even move into a different part of Pennsylvania, which would actually like change what your insurance options are in terms of the rating area that you live in Pennsylvania. So then you're eligible to shop and to pick a different plan, because if you moved from the western part of Pennsylvania to the northeastern part of Pennsylvania, that opens you up to shop. You experience a marriage or a divorce, a birth or an adoption of a child, you gain a court appointed dependent, you're released from incarceration. There's a whole kind of list of these things that open up this 60 days, what we call a special enrollment period. And then we also have these kind of other Pennie specific opportunities, including folks who are less than 150% of the federal poverty level. That would qualify somebody to get a special enrollment period with us. And this other opportunity that's after open enrollment every year, that's called the Path to Pennie. So if you miss open enrollment, a really great opportunity, I'm going to have a whole slide about this one, is called Path to Pennie. And this is basically tied to filing your taxes in Pennsylvania. So when you file your taxes, there's actually a little box you can check on the tax form that the exact language is like, I want to request information, right, about health insurance. And essentially what will happen, like I'm uninsured, I want to request information. They can securely send your information to Pennie, and then Pennie is going to send you notice and information, and you can get a 60-day enrollment period from when we send you that information. So it basically just creates another opportunity. If you go, say it's, January 22nd, and you go, oh, I just am learning about this, I missed this, I really wanted to check out this opportunity. It's to give folks another chance to potentially get coverage for 2025 if that's something that they were interested in doing. One thing that we're working on the outreach side right now is making sure that as many people who help Pennsylvanians file taxes know about this as possible, right? So that when they're filing taxes on behalf of folks who are working with them, that they can say, hey, do you have insurance? Because this is another opportunity to check it out. Just because you get the special enrollment period doesn't mean you have to enroll in Pennie. It just gives you the opportunity and like starts the process for you if you're interested. It's not an obligation to do it because you check the box. Just kind of cuts a few of the steps out for you if you're interested in checking it out. Also wanted to talk a little bit about the no wrong door policy. This is what I was talking about in terms of when you are a state-based marketplace. One of the advantages is the way you can partner with other state agencies. So this kind of talks about our partnership with DHS, which is wonderful. And for folks in terms of our relationship with CHIP and Medicaid, we have what's called a no wrong door policy. So if someone doesn't qualify for Medicaid, of course, we want to see them come over to Pennie because the chances are they're going to qualify for Pennie at either no cost or very little cost. If somebody has Medicaid coverage and they lose it, they actually get a 90-day special enrollment period to come over to Pennie. So they get longer than the 60, they get 90. So that's important to know if you're working with folks who may have MA and potentially for any reason lose it. Open enrollment is a great time too. If somebody had MA and during, folks may know during the last year and a half, Pennsylvania experienced the MA unwinding, where a lot of folks who stayed on MA as we went through the COVID pandemic lost it, right? Like some changes happened and many folks were actually finally taken off of MA and found themselves without coverage after having extended coverage and weren't sure what to do. If they missed that window that they were given to come over to Pennie, then open enrollment is another time they can come over. But this no wrong door policy essentially means if somebody doesn't know where to go, they can come to us and fill out an application. And if their federal poverty level means that they should be actually sent over to DHS to see if they qualify for Medicaid or CHIP, we can do that. Like our system will do that and send it over. If they're eligible, great. They'll go to MA, they'll go to CHIP, and they'll qualify through that. If they're not, they'll actually then kind of get marked as ineligible and come back to us. So it's supposed to cut out a little bit of back and forth for the consumer from trying to apply for both individually or taking the time of applying to one, being told no, then having to go to apply to another. And it's a great partnership that we have with them that we can do that all through our system. So if somebody just doesn't know and they're not sure where they would qualify for, they can just come to us and complete an application and feel confident that they will get the coverage that they're supposed to get. Again, it's part of our mission to get people the coverage that they're supposed to, the affordable coverage that's best for them. And that's part of why we have that partnership. And I did link a page on here. So folks will have this. It's right on our website. When you go to this page, there's actually like a very nice breakdown of like, I had MA before and I lost it, and it walks you through the steps. Or there's another piece of it that's like, I'm not sure if I should have MA or if I should have Pennie. So it kind of walks people through information for both of those situations, because we want to be kind of as helpful as we can for folks. So I also wanted to talk about how people enroll and what support's available, because we know this is probably the most confusing part. I just included like a very high level enrollment piece. I know that it's like, this is oversimplifying it because it can feel much more confusing to folks than this, but this is kind of the top level way that it works. Is there's a plan comparison tool. So people can go to our website and they can put in pretty simple information, nothing that identifies who they are, just to see what's available. So it's your income, your zip code, and your age, because all of those things affect what plans are available and what they cost. And that would show you what's in your area. So if I put that in for me, I would get to see, okay, here are all the plans that I could choose from, what they cover and what they cost. If I then decide like, oh, I'm interested in this sounds like something I want to do, I would get my household information together. And there's a whole checklist of like, you might want pay stubs, tax information, other information for people in my household. Then I'm going to go ahead and apply. I'm going to look at the different plans and compare, choose the one I want. I'm going to pay my first premium. That's kind of what officially enrolls me, and I'm going to be covered. But we know that people often need help with one or more parts of that process. So there's a lot of ways that we're set up to kind of do that. The website's there, and some people choose to just go through the website and do it themselves. If they can do that, that's great. Wonderful. If people feel like they need more help than that, which lots of folks do, there's our customer service number, which I do have on here. Good to know, like it says on there, Monday through Friday and Saturday hours. This Sunday is the open enrollment deadline. Absolutely open on Sunday, and they're open 8 to 10 p.m. So like this special dates, like the last day of open enrollment of this first deadline, they're there much longer. But generally they're around Monday through Friday and that partial day on Saturday. If you call there, you're going to get somebody who's trained and knows the application, knows all the parts, and can really walk someone through anywhere that they might get stuck on that application and enrollment process. Sometimes people want a lot more support than that. This is one of my favorite parts of what outreach does. We work with what we call enrollment assisters. These are folks who are in the community. So they might work in health centers, they might work for community-based organizations and nonprofits, but they are specially trained. The assisters and the brokers both go through a Pennie training every year to become Pennie certified. The assisters also have to go through a certification process in terms of through the Pennsylvania Insurance Department. And then they are available through this link that I put here, pennie.com/connect, to work with people in the community. So one of the ways you can do that is there's a feature that says find local help, and I'll show you that in a minute too, where you can actually put in your zip code and you can find all the assisters that are in and around your area. There's also an option to make an appointment with an assister. So you can put in your information and choose an appointment. We also, on our homepage of our website, have a calendar that just shows you where assisters are all over the state at any given time. Right now, during open enrollment, they're all over the place because we want them out, we want them active. A lot of times they're doing like education and outreach events, enrolling people different places. So the assisters are wonderful. They are like, they're community-based advocates, right? Like they're people who are already out in the community helping people, and they are especially trained to help people enroll in plans. Like that's what they do. The other layer of that are brokers. Like, so brokers are insurance brokers, but these are people who've chosen to become Pennie certified. So they don't work for Pennie. They might work for their own insurance company. They may own their own insurance company, but they've chosen to become Pennie certified so that they can specialize in helping people choose plans on Pennie. And they're another option that can help folks as well. And the times that we really refer people to use brokers are if you really want someone to be able to like actually recommend a plan for you. Because the assisters can help people enroll. The part that they can't do is say, like, hey, Craig, this plan is the best plan for your family. The assisters can't do that. They can show you the plans, they can show you all the options, but they can't tell you, like, this is the plan for your household. A broker really can do that because a broker has, different licensures, different training, right? Like that's part of what a broker does, right? Is they help people actually decide, they can make strong recommendations about plans and things like that. So sometimes people do choose to go to a Pennie certified broker because they want someone to just say, like, hey, this is what I would choose if I were in your situation, given your family's needs, your household size. So Pennie.com Connect, you can find broker or a sister. People can choose which one they like by zip code again. It's a really great part of what we're able to offer to people if they want that kind of personal support to help get them through the process. And then, of course, last but not least, we do have a chat feature. If somebody like doesn't want to be on the phone, they don't want to meet somebody in person, they just want to ask questions, they can do that as well. And this is just kind of a breakdown of all those things that I talked about and like who can do what. So like you'll see that I have like recommending a plan over another. An assister can't do that. It's red. A call center rep can't do that. The broker can do that. The call center rep can't offer in-person support. Assisters and brokers can. So to just give you a sense of like who can kind of do what. Really the only thing that an assister can't do is recommend the plan, a specific plan over another. And the brokers can pretty much do all of it, right? And then the call center reps really are more for, you want somebody that you can just call in and ask specific questions or get some of that support over the phone. I will say the call center reps have access to lots of language services, and a lot of our assisters, I was just actually looking at data from a survey we collected around the languages that our assisters are using to serve customers the other day. We have so many assisters serving people in a wide range of different languages. So that's something to know too, is that often people can find someone, definitely through the call center, we have access to lots of language support, but Pennie assisters too. We have a lot of folks that are from different communities and are able to serve people in different languages, which is really a wonderful thing too, is that people can be served in the language that is what they speak and is most helpful to them. And then just a couple other resources that I wanted to share with y'all. I talked about the events. You can always go to that calendar and see where people are. If you see our assisters or even any of us from the outreach team, sometimes we're the ones out at events. Say hi to us. The assisters often have, and us too, have like fun Pennie things to give away, like little umbrellas or tote bags or other swag. But we also can answer questions and talk to folks. The outreach team, so myself and the other folks that actually work for Pennie, cannot enroll people in Pennie plans, but the assisters can. So, if you see me at an event, I'm not able to enroll people, but if you meet an assister at an event, sometimes they're enrolling people at events. Often what they're doing, if they're at an event that's in the community and they're there to kind of talk to people and give educational information, they have little cards and they're scheduling appointments with people to enroll them later when they're in a place that has secure internet, is more private, because they need to get some of people's confidential information. So they're not often enrolling people in the middle of a community fair, but it's a great way for them to talk to people, meet people, get their information, make an appointment, and then make sure that they have time to meet with them privately and get them enrolled. I talked about that plan comparison tool where people can kind of browse the plans. Again, it's no identifying information. We're not getting your email address or your phone number. It's just where you live, your income and your age. And then you're able to see, okay, this is roughly what it would cost me per month for these different level plans. And then I also wanted to share, especially because I know there's folks doing community-based work, or you may even want some of this for your employees, for people that in your community. we have a page that's linked here that's you can get resources in different languages. You can either download them and print them, or there's a form that you can fill out and you can request that we send them to you. So we'll print them and ship them to you. And places like to get that, like our basic brochure, we have a palm card, and it's just to have it available in your site so that people can take it. Or if you're working with people where you might want to be referring, that you can give people a little card, a brochure that says like, hey, here's how you can get in touch with Pennie. Here's how you access the part on the website where you get in touch with an assister. If that's something that you think would be useful to you, please feel free to check that out and place an order. And like I said, we'll send it right to you because we want the word out there. We want more people to be able to get connected to us. And then I think this is the last slide I have. This is just, again, helping us. We're always looking for more people to know about what we do. If you're active on social media, we do have social media accounts, letting people know when deadlines are and how to get access to support. I talked about that toolkit. We are always happy to do what I'm doing today, to either come to you in person or to do a virtual presentation if you think it's helpful, whether it's for your staff or your community members, for whoever it might be. There's just so many people to talk to in Pennsylvania. We've only been around for 5 years. So it's always amazing to me, like how many people we talk to that just go, I didn't know about this. And we want everybody to know about it because we think it's such a great resource. And we're also always happy to come to those events in the community. And if Pennie Outreach can't be there, we have our wonderful sisters who can come to events. But if you're having an event where you think it would benefit the community to have people there that can talk a little bit about Pennie, give out resources, we're always happy to do that too. And then I just put the line for the contact center. If anybody ever has a question or wants to make a referral, that's the number for that as well.